On October 8, 2005, Lamir Jan's home collapsed and her 18-year-old son was killed when a terrible earthquake rocked northern Pakistan. 73,000 people died and 3.5 million were displaced. A year later, her family of 6 still lives in a tent. They face another hard winter. But Lamir Jan, 9 months pregnant, will at least have the chance to give birth safely in a fully equipped hospital. A female doctor and a midwife regularly visit her camp to give prenatal care. At least 5,000 women give birth each month in the earthquake-affected areas. Families have returned to their villages, but reconstruction is slow. Most survivors still live in tents or makeshift shelters. Exposure, crowding, weak diets, and bad sanitation compound health problems that existed in this poor region before the earthquake. Restoring medical services is a priority for the government and the many aid groups that responded to the crisis. Care for children and mothers is a major concern. Jan van der Murtel is the UN's humanitarian coordinator in Pakistan.
The achievement is that we had a successful relief operations. We had a very complex reconstruction. 80% of the health facilities were destroyed. That's over 500 facilities. This winter, the acid test for our preparedness will be the health sector.
1 year on, prefabricated units have replaced medical tents. UNFPA, the UN Population Fund, is putting up 34 maternal and child health facilities in the hardest hit areas. In areas where male physicians cannot examine women, the all-female live-in staff provide primary care, prenatal checkups, and skilled deliveries round the clock. At the Chhattar Plain Health Center, Narjis, mother of 4, asked Dr. Simi Khan about family planning methods. For the first time ever, mobile service teams are visiting isolated Kashmiri villages like Mastana Gali, where the earthquake wrecked 80% of the homes. Nasima, 2 months pregnant, gets a prenatal exam and advice on nutrition, health, and safe childbirth. Women in northern Pakistan typically have 6 or 7 children. Most give birth at home, and maternal mortality is high. But with new access to health care, more and more women are coming to life-saving facilities like the Prefab Maternity Center at Hattiyan Bala in the Jhelum Valley. Nazia, 19, has just given birth. She was married a month before the earthquake. Her home village was buried under a landslide, killing most of her family. Patients with potential complications can be referred to the more advanced AIMS Hospital in Muzaffarabad, where 406 babies were born last month. Doctors delivered Praveen's baby by cesarean section. 3 of Praveen's 5 children died in the earthquake. 1 was just a day old. A baby boom continues in the region devastated 1 year ago. Rebuilding will take years, but healthcare for many mothers and infants is already better than before the earthquake. This report was prepared by the United Nations.